episode is brought to you by Jing's Mortgage Team. Jing's Mortgage Team is a team of real estate mortgage professionals whose mission is to help anyone with their real estate needs. If you're looking to buy a home, sell a home, refinance your home, have credit issues, or in need of an investment loan, we can definitely help you. If you're looking for a real estate agent, we know the best of the best real estate agents. Visit the link below for more information. Thank you so much.
Thank you for having me.
Coming on Secret Sauce with Hamilton Lao. It is an absolute honor to have you on. I am a super big fan of Everyday Heroes. If you guys don't know, Jessica, she is a registered nurse.
Yes.
And she actually started her career in the heart of the coronavirus pandemic.
Correct.
And it's just an incredible story of camaraderie, of overcoming hardship. I'm sure you can imagine, for my viewers, everybody has a story during the pandemic. And this is, to me, so important to document what had happened, at least from Jessica's perspective. And especially if you're watching this 100 years from now, right? Just to get an account of what was going on at the time of the pandemic. You know, this is the episode for you. So, Jessica, thank you again so much. Thank you so much for coming on. I wanted to, again, peel back the curtain on the secret sauce that makes incredible people incredible. You know, how you overcame that situation, you know, what was going through your mind at the time. But first, of course, please tell us a little bit about yourself, how you got into nursing. Yeah, just please.
So I started in 2015 as a nursing assistant. And after a few more years of working as an assistant, I decided to go back to school. Took my prereqs while working, and I got into the nursing program. I started in 2017, I believe, and I did the accelerated program, and then I started working as an RN in 2021. Sorry about the dates, because I forget about the dates. So I had graduated on May 2020, right when the pandemic was getting like severely worse. And I started as a registered nurse, as a new grad, on a COVID floor. So that was interesting, both scary at the same time, because as a new grad, you know, you're trying to learn everything, and now we're learning something completely new, something that we don't know. So it was scary.
Yeah.
I would say that it was very scary, but at the same time, it was rewarding in a way, because I got to meet a lot of people.
Yeah.
The reason why I had gotten into nursing was because an experience of mine. My mother, many years ago, I was about 13 at that time. It was New Year's Eve. She got very sick, and we had a little small family event at my sister's house, and we didn't really know what was going on. She was just complaining of like an earache. We didn't think much about it. We were just like, all right, just take some Tylenol and just go to bed. And throughout the night, it just got progressively worse. And to the point where she stood up from the bed and she came out, and her ear started bleeding. She said she felt a pop, and it was just bleeding through her ear, so they rushed her to the ER. I was so young. My sister decided to leave. My sister's 11 years older than me. She was like, you know, leave the kids. You know, I have a younger brother, 1 year younger. So we left. We stayed while I stayed with my father and my sister, her husband, and my aunt. They all rushed her to the hospital because she became unconscious. They put her in an induced coma for 3 days. I had no idea. My sister didn't tell us for like 4 or 5 days because they weren't sure if my mother was going to make it or not. She ended up developing meningitis, and it traveled all the way to her brain.
Wow.
So I guess when that pop happened, I don't know if the bacteria just somehow just kind of spread everywhere. So they had to put her in a coma to kind of let her rest. And after she was able to get out of the coma and she got better, I was able to see her. And that is when I will never forget, actually. It took me a month to go and see her. And I sat there and I remember like seeing the staff, seeing like the nurses and like looking around the room. And I thought, like, as absurd as it would sound, like I would see like in the back, like, because we have like the oxygen, we have like the blood pressure cuffs, like for manual blood pressures. And I thought it was like the coolest thing, you know. And I remember seeing this wonderful nurse. I don't even know her name. And she was just like, you know, being so compassionate to my mom and, you know, being, you know, taking her time and like, you know, educating her and like, you know, giving her the medications. This is what I'm going to give you and this and that. And I remember telling my mom, like, you know, I want to be that. Like, she made such a impact on me that I saw how much they took care of my mom and they practically saved her life. And I just admired that. I admired like the whole nursing aspect as well as the doctors and the PAs, everybody that was involved in my mom's care. And I think that's really where everything started for me, where I knew that I wanted to care for people the same way that they cared for my mom.
Wow.
And that's probably, I would say, why I went into the nursing route, because I want to make a difference in my patients. I really do. I want to make the same impact that those nurses made me, like that
For your mom.
for my mom. I want to do that for them.
Wow. You know, it's like something to be said about the emotional health of people, not just the physical health, right?
Yeah.
If you're in this weird, strange place that you've never been to, you don't know what kind of surgery, what exactly is being done on you, right? There's just that extra sense of comfort. I mean, that sense of comfort could be what is working the miracle to make somebody, you know, heal or potentially get better. You know, I'm not a doctor or anything. I'm just saying, like, you know, I could imagine somebody that feels happy and comfortable, they would be, you know, more energetic or potentially can get better, you know, quicker or even heal faster compared to somebody who's miserable or I don't know, just
Exactly, yeah.
brain fart. I don't know, but wow, that's incredible. Thank you
Yeah.
so much for
No
that.
problem.
So I guess that kind of lays the foundation for yourself
Yes.
when you go to work and really want to help and you know those patients that you're working with, right? Oh, that's amazing. So from there on, I guess you know you got into nursing
Yes.
assistant program at St. Francis, right, your local hospital. And yeah, tell us about that experience. I think you started in 2017.
As a nursing assistant, I started in 2015.
Oh, 2015.
Yeah,
Right.
2015.
2015.
So what we have is we have a comfort care provider, CCP, what they call it.
Oh.
It took me a second there. So that's a little bit below from being a PCA, which is a patient care provider, which is a little bit more responsibility. I did a CCP job for a year, day shift. And then when I started thinking about going back to school and I had to take the prereqs, I went to become a PCA. And then I worked in the evenings from
And
3
PCA
to
stands
11
for
patient care provider.
Oh, okay.
Yeah. I mean, patient care associate.
Oh,
sorry.
okay.
So I did that for about 6 years, I
Right,
believe.
right, yeah,
Yeah,
right.
that makes sense.
All the
Yeah,
way to
for 6
2021,
years. And it was interesting. I stayed in the same unit. I worked in a med search unit, telemetry. I met so many people from all around the world, honestly, even from some famous people to, you know, regular people. But, you know, everybody has their own, you know, different cases of, you know, why they're coming to the hospital.
Needs
And
and-
it was, yeah, it was an interesting time. And it really helped me develop to become a better nurse.
Right.
Because I wasn't not afraid. I remember my first time, like my first week on training as a CCP. I wouldn't want to get near the patient. I was so scared because like every beep, like sound or alarm, it was like, like did I touch something, or like was I not supposed to do that, or like if the patient would like scream or something, I would be like, oh my God, like I'm never getting near the patient. So like that fear like slowly kind of just went away.
Wow.
And yeah, no, it really prepared me to become a nurse, because like once I became a nurse, like it was second nature. Like
Yeah.
I just knew what I needed to do. You know, the responsibilities change. You know, you have a life in your hands now. So
Yeah.
it's a little bit, you know, intimidating at times, you know, because like, you know, you're trying to do the best as possible for your patient. And, you know, and the responsibility a lot of the times is your clinical decision, what you think is best for the patient.
Right.
So it's a lot of critical thinking that you have to really think. And yeah, that's pretty much.
Yeah, when you became a nursing assistant, you know, during that time, was it what you had expected? Especially thinking back to, you know, your childhood experience, was it something that, you know, was it off-putting for you, or was it like, wow, this is exactly what I'm meant to do? Did you get that kind of
I felt like I knew that this is what I wanted to do.
Wow.
I knew from like even from working from day shift to evening shift to night shift, I knew like I was like, the relationship that you build with these patients, it's truly amazing. You know, I love having a conversation with the patient because like you learn a lot, and I learn a lot from myself as well. I've gone through so many experiences throughout all those years, and I just knew, having that caring, compassionate, you know, it's just like, I guess like maybe like I would say where, how would I put it into words? It's just that trusting bond that you have, that they trust you
with everything?
with everything.
Yeah.
And, you know, it's hard enough to trust somebody, you know, especially a total stranger. So it's just very rewarding, and I knew that this is what I wanted to do. And, you know, I appreciated every single moment of it during all that time, whether it was, you know, pre-pandemic. But
Yeah.
it was very nice.
Yeah.
Yeah.
So you got into the accelerated nursing program in
Yes.
2017, and you know you progressed through it up until 2020, right? The year that kind of changed it all for the world, right? And it must have been an interesting experience because you graduated in May, and right, May of
Yeah.
2020, and lockdown, I believe, started happening around March.
Yes.
So there was like an interesting 2 months, right, at that
Yeah.
time. Like talk about that a little bit.
So when I was in, I did a lot of commuting to go all the way out to New Rochelle.
Was that for school or
For school,
okay.
yeah. So I was taking a class. It was a community class actually, and it wasn't serious yet at that time. It was kind of thrown in the air about, oh, there's a new virus. You know, just be careful, this and that. And then I remember my professor said, you know, I wouldn't be surprised if we're gonna end up doing remote classes like through Zoom or something like that, because I think like it's gonna come here. And all of us, we were like, no, there's no way. I'm
Yeah.
like, we have it all under control. You know how like sometimes the social media and like, you know, the media as well, like they try to portray something
Right.
a little too much or
Right.
be
Yes.
dramatic about
Yes.
it.
Yes.
So we're like, there's no way.
Yeah.
And during, I believe it was like around March, I think where I was in New Rochelle, that was the epicenter that started, that we had that first COVID patient. And some of the clinical instructors were working in the hospital where this individual was. And some of them, I guess they didn't know that, you know, how it was transmitted at that time. So a certain people ended up getting COVID. So from that, then it passed on to some students. It went to like, you know, some professors. It just kept on like just getting
Wow.
worse and worse.
That must have been a crazy experience.
It was, because like
you, yeah.
we're like, oh my God, like like you don't know. It's like, oh, they tested positive, and
In New Rochelle,
yeah, New
where you
Rochelle,
were going to
that's right.
school.
I was just like, oh my God, like I
It's
was
crazy.
with that
Yeah.
teacher the other day,
Yep.
you know. So you're like thinking about yourself. I'm like, oh my God, did I get like, do I have COVID? So then eventually they started changing the classes to going just on Zoom. At that time, they were trying to figure out how to use Blackboard
Yeah.
because like we never done this before.
Oh
we
yeah,
never
that's
done
right.
this before.
So just a little context for our viewers. If it's like 100 years from now and you're watching this, I remember too. The person that got infected initially, he was traveling from Grand Central, and
Oh.
yeah, and I think he lived in New Rochelle, and
Yeah.
by the time he actually got sick, they had sent a bunch of people, the tracers,
Yes.
and it was already breaking news that he didn't really had any symptoms for about like a week or two or
Yeah.
something like that. And he's already been traveling to Grand Central. I remember I was in Queens and I'm like, oh, we're sure everybody got it.
That's what I'm like. At this point,
like,
it was.
we're just
That's
like,
it.
it was really
Literally,
nuts.
that's like, oh, geez.
Yeah, it was
So
pretty crazy.
it was a lot. So we, having to transition from going to classroom to now everything
Yeah.
online. It was a lot.
Yeah.
Having to take the test.
The last class that you had to take
my
to
last
graduate,
class.
right?
Exactly, and I'm like, what do we do? And it was tough to deal with because some people's like didn't have laptops. There was no, like their cameras weren't working, or like it depended on their schedule too, like to see when we can fit time. It was an adjustment, I would say, to having to do everything through, video. And but we managed, and I graduated. Though my graduation, as I told you before, I had it on a screen,
Yeah.
and that was pretty much it. I missed out on my pinning ceremony and walking down, which things that I worked so hard on becoming a nurse, and nobody knew how severe the pandemic, the COVID was going to get, and how it really affected everywhere, all around the world, not just here in United States, but everywhere. And I at least I don't feel so left out that I didn't get like a proper graduation. But at the end of the day, I'm happy I'm a registered nurse.
Yes.
And I did, I became, a professional, I guess I would say.
It must have been a strange experience during that Zoom graduation, right? Because the person that was facilitating the event, it's like, what do you say to nurses that are about to be sent out into the field where you don't know what is happening, you don't know how to treat this virus, and for many students, they may be going, to their death, right?
Yeah.
Because you don't even know.
Exactly,
But if you remember, like, can you talk a little bit about what the director was saying?
Honestly, he was very brief.
Yeah,
I wouldn't say he
right.
really said anything much about it. I think he just kind of said, I hope all you guys are safe and your family. But at that time, too, there was a little bit of a shortage of nurses. Because the hospitals were full of COVID, and there were so many patients.
At this time was May, right?
Exactly, and we didn't have enough staff.
Right.
So they were giving permission for people who had graduated, but not like as a permit that you could use before until you take your NCLEX.
Right.
So you could still practice, but with certain limitations, obviously. And it was scary because I remember I was about to do that, and then I'm like, oh geez, like I don't know if I should do it, or what if I don't pass my NCLEX, because of the stress level as working and trying to study.
Right.
And also you can jeopardize your license. So I was like, I best not do it.
Right.
I'd rather just go slow, even though everything took a long time, because to take the test, there was such limited seats, and I had to keep on looking to see if like October came, November came, and then finally I was able to do it in December, and that's when I took the test and I passed.
Right. That was in 2020?
In
Oh, right,
2020,
right.
yeah, and then when I started working as a nurse was in January of 2021.
Right, right. So after you graduated from May, I think you went back into as a nursing assistant, right? Back at St. Francis.
Yeah, I was working as a nursing
Right, right.
assistant.
So please, like, tell us how that experience was like going into the heart of the fire, right?
Yeah.
Because, please, yeah, it's
So we had our unit actually was the first that we had the first COVID patient, and we have like 2 rooms where like they're negative pressure rooms. They're like are able to get whatever that's in the room. It sucks it out and goes through a different vent.
no.
So I remember with my colleagues, we were curious, but at the same time we were terrified to go into the room. Because like we would see like a bunch of signs all over and saying like they weren't sure if it was airborne. Then they said it was contact, meaning you have to wear a gown. They weren't sure if it was like either droplet, where you have to wear like a
Right.
regular like a surgical mask.
Right, and,
like
and this
that.
was like your first experience
Yeah, like our first,
into
like,
the building.
Into the building, like
It's like, oh.
I was just like, oh my God, like I remember people didn't want to go in there, but the patient looked fine, like you didn't see any symptoms like what they say, like, oh my God, how like in the media they would say like, oh, like if you have COVID, like you might end up, dying
Right,
and this and that.
right.
But it wasn't like that. And after I had left, I was off for a couple of days, for like 3 days. I come back. Remember, we only had 1 patient. I come back, the whole unit, we have, 2 beds in each room, was packed, with all COVID patients.
Wow.
With all COVID patients. So, in that point, I was just like, wow, this is serious. Like, this is not a joke anymore. And, every person was different. People had respiratory problems where they couldn't breathe. Others, have had very mild symptoms, like either they lost their sense of smell or, their sense of taste, like little mild symptoms, but because you have COVID, their first instinct is to go to the hospital. Like, that's it. Like, let's see if we can treat it. Because obviously, we were hearing a lot that people were dying, they were gasping for air, so it was terrifying coming back and seeing, wow, like it took in a matter of 3 days for this entire unit to be filled with COVID patients. So that was scary.
I
That was
remember
very scary.
hearing the news report at the time that the emergency service providers, the ambulances, the EMS that were going out there, they were actually, when they were picking up the phone, they were saying, hey, if you're not dying at this point, like if you can't breathe, then we'll come. But like if it's just symptoms, you're getting symptoms, like stay home in quarantine for 2 weeks. And and that's as a result of this huge flood, this huge wave of people just getting these symptoms suddenly, and like a lot of people were just not able to breathe, and they had to go to the hospital. And you were, I guess, the destination for that huge wave that was coming in, this hospital that you were working at.
It was a very, like I said, very scary time because, what do you do?
Yeah.
We don't know.
And there wasn't enough beds at the time,
There was
right?
not
Right.
enough beds, and
Right.
then the ER's piling. I think they try to call like a diversion where like we can't fit any more people, so they have to go to other hospitals to see if there's enough beds there. But it just, we're having more and more patients, and some of them, they're gasping for air, and all we could do is put like either a nasal cannula, which is like a little bit of oxygen that they receive, to try to keep them as comfortable as possible. But we didn't know what treatments to do. We didn't know how to stop this, So, and people like you said, with mild symptoms, even though like they could have been perfectly fine at home, as long as, like, if they had any respiratory issues where they're having a hard time breathing, yeah, then go to the hospital. But most of the time we did get a lot of patients that are very mild. It wasn't like that, severe. But we always took in priority the ones that were struggling to breathe, because we were intubating patients left and right.
And just so our viewers that don't know, what does that mean, intubating?
Where we put like a ventilation where it's able for them to breathe, give the lungs a rest, and it's doing the ventilation for you.
Oh, I see. It's like a machine
It's a machine, yeah.
Oh, that infamous machine that we all heard about, right? That also hospitals didn't have enough of at the
Yes.
time, right?
Yeah.
Wow. So a lot of people came, and got on that.
Yeah.
And I did hear some accounts that the machine, even though they get hooked up, sometimes it wasn't help. It didn't help
No.
because it was
It
just
was
so.
a little too late at times. Most of the time, people would wait too late, right when the symptoms got way worse, and waited until they couldn't breathe, and then at that point, there was really low chance of you being able to survive, because then, your lungs fill up, and then, your lungs get tired from so much of the gasping of, breathing. And no matter what we do, whether we're giving you oxygen or the high flow, which is more intense oxygen, nothing seems to be working, then the last resort is to intubate.
Right.
And some unfortunately didn't make it, and some actually recovered, that were able to get extubated, and they're alive now.
Right.
But we did run out of things. I think everywhere, mostly all the hospitals, we run out of masks, we run out of gloves, we run out of gowns, because we didn't know how this was transmitting at that time, because they were changing their minds all the time. So I remember I would have like 2 masks, an N95 on top of it, and at points where it will be so tight that you would develop ulcers here,
Oh, God.
like pressure injuries
Yeah.
from wearing for long periods of time. But it was the only way that could protect you, and it was a tough time.
Yeah. Now, from May, from your graduation all the way up until January, where I'm assuming a position had opened for you at St. Francis. During that time, again, you came back as a nursing assistant, and you had I'm sure you had opportunity to say, "Hey, wow, this is nuts. I don't want to do this," right?
Yeah.
And did that thought ever occur to you that this isn't for me? Maybe I should choose another career path, because that's just not enough beds. People are dying left and right.
Yeah.
Did it ever occur to you? Again, your life is on the line.
That's true. I mean, I would say I thought about it, but then eventually I knew, I'm like, no, this is what I signed up for. I knew I wanted to be a nurse, and I just wanted to be there for the patients. Otherwise, who else is going to do it?
Right.
If nobody's there, and like I said before, I want to make a difference in my patient's life, and I knew what I was getting myself into. I knew that I was also putting my family at risk as well, with contracting COVID, and I knew the risks that came with it, but I was determined, and I knew, and I was a brand new grad. I was excited, I was energized, and I was ready to just go and do it.
Yeah, I think especially since you were new at the time, I feel like when people encounter a new experience, especially if it's a hard experience, there's a sense of like a sink or a swim type of a mentality. It's like, okay, wow, this is really hard. Should I run? Should I continue? Were there any coping mechanisms that you had at the time? Because this is no joke. People are dying left and
Yeah.
right. You don't know if, hey, the next day that I go to work might be my last day. Was
Yeah.
what got you through that time?
I would say my coworkers, for sure. There was a lot of support from both ends. We were all there for a mission to make sure that these patients were stable, make it out alive, and we all supported one another. It honestly, I wouldn't know what I would have done if I didn't have them. We all helped each other. We had such great teamwork. We all like, will help each other out. You need somebody to be medicated, like what's going on? Do you need help? That was, I would say my support, like my
Your
those
secret
were
sauce,
my
your secret
yeah,
sauce
yeah.
at the
Those
time.
were my girls and guys as
Yeah,
well,
yes.
and they, I gotta say that if it wasn't for them, honestly, I don't know. I don't know how I would have done, because it is in a way mentally draining to see these patients, and also to you kind of felt isolated as well, and they felt isolated, the patients as well, because they couldn't see their family members. Everything was through FaceTime, and I was their family member in that moment. So I try to bring in, be compassionate, always build conversation. I wasn't afraid anymore. In the beginning, I would say, yeah, I was afraid, maybe because I didn't know what it would do to me, or my family. I didn't even know if I would lose my parents, the two people that I was trying to protect the most, and then once I end up getting COVID, I was like, you know what? There's nothing to be afraid of, There was nothing to be afraid. I would just go into the rooms with no hesitation, even though I was putting my life at risk. But I knew what I was determined to, and just like making patients feel like it's not home, but somewhat feel like they're a human being. They're not just a patient,
Coming back to that foundation,
exactly
that experience that you had as a kid, right?
Yeah.
Wow, that's amazing. And was there like a sense of inspiration from watching your coworkers as well? Because
yeah.
you weren't doing this alone, as you were mentioning.
Yeah.
There was a sense of camaraderie and seeing others go through hardship, whether easier, less hardship or more hardship than you. Did you draw inspiration from them as well to continue because you saw that?
It gave me a lot of courage, a lot of strength.
Can you talk about that? Yeah, absolutely.
A lot of courage to not be afraid, and just give it all you got. I think a lot of the times, if they're not afraid, why should I be afraid?
Wow.
I felt like that in that sense, and it made me a stronger person, a stronger nurse, to treat these patients better, or but it gave me a lot of courage. I would say a lot of courage and strength. I would say a lot of strength.
Yeah. Wow. So you got the position in January. Needless to say, there was no hesitation. I'm taking this position, right?
Yeah. That's pretty much. I knew what I was getting myself into, and I was just like, okay, it's fine. I'm sure it'll get better.
Yeah.
In time. You know how they said it was going to only take a year. It will take a year and it will go away. Obviously, nobody knew it was going to be, 2 years, almost going into, 3 years.
Yeah, right.
But now, obviously, we know what's working. We had experimented a little bit with medications to see what's effective, what can improve their symptoms. Also, with the vaccinations too, were a big help. Even though it turned into kind of a political, where they didn't want to take the vaccinations and things like that.
Yeah.
So that was another.
Yeah, I mean, what was interesting was at the time when the pandemic, everybody was on lockdown in March 2020. There was no vaccines until, I think there were talks of it around November, December of 2020.
Yeah.
There were talks of vaccines.
Yeah.
And it really wasn't rolled out publicly. I remember I got mine. I tried to be one of the first people to get it at the time. I think I got mine like April or May of 2021. So it wasn't until it wasn't publicly available for something like 9 months to a year,
Yeah.
So during that entire time, it was just amazing and incredible to me that, there was no vaccine at the time. You didn't know what it was going to do to you. People were dying left and right. And despite all of that, despite this burning building of COVID, right? You and your, colleagues decided, hey, I'm not running away from that. I'm gonna go straight into it, which again, to me, is the definition of a hero. So thank you again, thank you again so much for all the service that you and your colleagues do. So once you became a nurse, talk about your experiences then. Because I know at the time, the issue with the beds wasn't like the full, pandemic. There were a bed shortage, right? It was like in waves, I believe.
It was
There
in
were
waves,
times, right?
yeah. There was times like, for example, like winter time, like November, December, October. We noticed that it will be like all of a sudden of influx of patients. Now, when it would turn into the warmer months, like probably around May, June, like to maybe I'll say September, you will see less and less. So the restrictions were getting less, so, but then eventually we were getting ourselves mentally prepared knowing that by the time that October or November hits, we knew we're probably going to get another influx. It feels like how that COVID kind of took over the flu, because like during the flu seasons, we were getting an influx of people with flu all the time. But because we were wearing the masks, you didn't see any more flu anymore. It looked like flu had converted to COVID, and that was the new norm now.
Right.
That was what we were going to have
Right.
to deal with.
Right. As far as the patients that were coming in, the
Exactly.
needs, right? It just became
Like-
COVID.
It was just all COVID. Every time we were just testing people left and right with the PCRs. And it wasn't even, we would throw in just like a flu just to be sure it's not flu. But no, it will come back negative, and then they'll come back positive, COVID positive. So, it came in waves, I would say, definitely. During the winter months, it was a little bit more tough, because then we had to rearrange what units would take the COVID patients, as well as the ICUs. There's certain ICUs that have to be just like focused on like surgical patients that are like, or as well as like for hospice, the oncology unit, they couldn't be near because they're immune compromised.
Exactly.
So things like that, they had to kind of figure it out. And I think it's like, in every hospital, they have to find some sort of bed. The patient had to go somewhere. But once we kind of knew
system in
what we're
place,
heading
right.
to, we kind of knew what we were doing.
Right.
So it kind of worked out eventually as time went on, until we figured out what's going on. But yeah, that was an interesting time, I would say. Yeah, it was scary.
I have to ask you, in a profession where you're surrounded, especially during this pandemic time, in a profession where you're surrounded by death and, so much, people that are coming in who otherwise would probably be healthy, then suddenly they catch this, this virus, and they just go in a few weeks, right? I mean, talk about any perspective changes that you've gained, just from seeing, hey, just a regular person suddenly, otherwise healthy, suddenly get coronavirus and then they pass away. Was there a perspective, a new perspective that you gained that maybe the audience can benefit?
I would say more that I should, I guess, not to take my life for granted, to enjoy every day as if it was your last. Be with your family more, because I think that we needed that break, we needed that lockdown to really focus, because I think people were so focused on work, were focused on their cell phones and everything else, that we lost that sense of touch of having to be with family, like actually have a conversation with family members and just feel the love. And I think I learned to, live my life as happy as I can be in a positive way. So I would say in that way that I really cherish the moments that I had, during March and where the lockdown was, because those were the fun times for me, even though it didn't consist of having to go out to a restaurant or, go out somewhere else. But I was just there with family, we were all together finally sitting down with not having any restrictions or somebody having to go to work or, everything was from home.
Right.
But for me, obviously, I had to work at a hospital. But those are the moments that I cherish the most, I would say. And
Most memorable for you.
yeah, it was, because you really got to appreciate your life and really reflect on things that you probably didn't focus on so much, being, like I said, with your family, or with your friends, your closest friends. So there was a lot of things that I learned about myself too during that time. But yeah, I would say like, live your life.
Yeah.
Live your life as if it was your last, because you never know. You never
Yeah.
know.
Talk to us about the experience during a time when there wasn't enough beds and suddenly the person had to be incubated, I believe it's called, right? Incubated and
Oh, intubated.
intubated. Sorry, intubated. Sorry, not a medical. Let's be sorry, intubated. But and it's one of those situations where they're probably not going to make it because of COVID. I mean, without naming names, of course, like, you know, what was that like to see, family come in and it might be the last time that they see the person, you know?
So I had a patient, actually this is when I was still about to graduate. I A lady was actually pressing the call bell, and I went into the room, and she was like gasping for air, and she was like telling me I can't breathe. So I was telling her, just calm down. I was like kind of showing her, just take some deep breaths, just relax, because like it's also anxiety as well, because like you're panicking, so you're over hyperventilating yourself. So I told her, I said, just relax, it's okay. And I just noticed, like, because she was on a non-rebreather, what we call that is it's 100% oxygen. It's a bag that you wear, like a little mask here in a bag, where it's giving you 100% oxygen, just flowing right through. That wasn't even working. So I remember I was like, oh my God, this lady's not doing well. So what we would do is we would put the patients in a prone position where we have them on their bellies, so it can expand, their lungs can expand. I told her, I said, just go on your belly. I said, and start like kind of like hover over like this and just breathe. I said, just breathe and breathe. And that wasn't helping, so I had no choice. I called the nurse and I said, she's having a difficult time. She's desatting on her oxygen. I believe when I looked at it, she was like around 78, which is very low. You wanted between 92 to 100. So she calls, the PA, she calls the doctors, and they're like, okay, we're gonna intubate. That's it. So at first she was like, no, 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 I don't want to get intubated. And we weren't allowing family members at that time. So they were like, you need to call your family now. We're gonna FaceTime them now because you're gonna get intubated right now. Otherwise, you're not gonna make it. And they didn't even have time. They weren't picking up. And that was it.
Wow.
She got intubated, but to this day, honestly, I don't know if she made it out alive. I don't know. But the fact that, like, when it comes to a decision like that, and you have seconds to tell your family, like, at least your goodbyes, and and you can't, like, we're trying to save you. And it was hard for me. That was very traumatic, because I never seen an intubation before. That was my very first time.
Oh, this was during when you were a nursing assistant.
Yeah,
You just started as a nursing assistant. Not just started, but after you graduated.
After
Right.
after I had graduated,
Right.
and I was like, oh my God, like, this is what an intubation consists of. Usually most of the time patients go to the ICUs and get intubated there, but this time they did it right there at the bedside, and they didn't have time to wait for family to say, okay, yeah, bye. At that time we were just waiting for FaceTime to say, okay, say your goodbyes.
Right.
Because there was literally a low chance that you might die. I mean, that you
survive.
might make it. Yeah, that you might.
So once you're
survive.
at the time, once you're intubated,
The likelihood of you getting extubated is
low.
like low.
And I think you were mentioning that at the height it was like 6 per day that was getting intubated. Right?
I believe, yeah, around there.
Around
it was
there.
around there until we
Wow.
started running out of machines. We had to use different types of older machines that we had there.
Wow.
To keep these patients,
Yeah.
safe.
And sometimes families were able to get on FaceTime and say their goodbyes, and sadly sometimes no. Like it just
Exactly, like
Wow.
that it was sad. I
Yeah.
would say it was a sad time because some people didn't make it.
Yeah.
We tried our best, and COVID just, you know, COVID had no boundaries. It
Yeah.
didn't matter whether if you were rich, poor, the most educated, you could have been a doctor, a nurse, a nursing assistant, anything. COVID didn't care. It'd take whoever,
Yeah.
so, yeah.
Yeah, would you say, as you were mentioning, that you definitely, that big lesson that you took was to not take your life for granted, because you just, I mean, we're luckily not in the heart of the pandemic anymore. It's 2023 for those that you are listening, and right now we
Yeah.
don't have masks on, fortunately. There's vaccines out, and everybody is. We still hear some talks about COVID, but it's
But
not
it's not
as
like as much
as
talked
front
about,
page
right?
news as
Yeah.
it was in the height of the pandemic,
Yeah.
So fortunately, we're okay now, but there was a time when, it was kind of the end. Like
Yeah.
you got it, and it was just like, oh boy.
That's it.
So yeah, so
Pretty much.
yeah, so it's like, definitely a big lesson was not to take your life for granted. But was there another experience that you've had where it's just like, you know, uh, the experience with the lawyer? I mean, this was
This was pre-pandemic.
this was
Yeah.
pre-pandemic. Oh, okay. Just I guess as an additional anecdote for our viewers,
Sure.
could you talk about a little bit about that, like uh, along the lines of not taking your life for granted, because you just never know.
Yep. So I had this patient. I was in between two rooms, and I was gonna go attend to the other patient right next door, and I saw a doctor go into the room, and I somehow decided to stay in between trying to fix one of the boards that we have there, and I heard the doctor say to the patient, like, "You're not going home, you're going to die, and you're going to stay here." And then he walked out. So in that moment, I knew that I had to kind of stay, like, I was thinking to myself, did he just say that he was going to die? It took me like a couple seconds, and I remember I knew he was going to press the call bell. I'm talking about the patient. And he pressed the call bell, and I remember going in, I took a deep breath, and then I was like, "Hey," and then I sat down right next to his bed, because he was sitting in a chair. And he was like, "Jess, I need to talk to you." So I was like, "Yeah, what's up?" And then he was like, "The doctor just told me I'm going to die." So like in that moment, you're thinking like, what do I say? There's nothing that I can say to make this patient feel better. All I could come up with, it was like, I'm really sorry. Like, I'm so sorry. I was like, I just don't know what to say to you. And then he was like, "Why don't you, like, stay here for a bit, and I just want to talk about you, about my life." He had told me that he was a lawyer, that he had two beautiful children, and he was very successful at his job. But he said that one of the biggest regrets that he's had is that he focused so much on work that he didn't focus on his family. And he says he wishes that he could take back that time and maybe put the job and not be so, focused on it, that he would see his children grow, but he was so invested in making money that he said, "Look," he's like, "I have all this money and there's nothing I can do. What is the money going to do now? Nothing, So in that moment, it was nice to hear him, like, just kind of vent and tell me about, things that has gone through his life, him, going through a second marriage. He didn't have any kids with the second wife, but his kids were all grown up, they had their own lives. But like, I guess maybe because he was not such a included or involved in their life, I guess the children weren't as involved in his, I would say. They were more isolated to him. But it was just nice to hear from his perspective, from a very successful lawyer, knowing that, he achieved all these things and he still had regrets. You would think a professional being like, you have everything that you wanted, you have all the money, the nice houses, the cars, you have everything. But it's that moment, like that moment where you kind of reflect and you think, not money is always happiness.
Because you can't take that with you, right?
You can't.
But you know what you can
But,
take
like,
is like the emotions
exactly,
and the
the
memories,
love,
the
like
feeling.
the
Right.
feeling of feeling loved, and I think that's what he wanted to tell me about that. Like
Wow.
he had that regret, and I think it was a way of him telling me in a sort of way, like, focus on your family, like, be close to your parents, like, and don't focus. Yeah, having a career is nice, don't get me wrong, and trying to make money, living comfortably, but also don't forget that you have a family. I think that's where he was trying to say that not always money brings happiness. It's families, the memories, is the love, and I think that's what he was trying to tell me. Unfortunately, he ended up,
Yeah.
he passed
Awesome.
away. But I did tell him that that day that he shouldn't feel alone, that we're all there for him, because he did feel alone. He felt alone. Nobody really came to visit him. It was just like his wife. And, I said, I'm going to be there. Don't worry, I'm going to be there. And I was there for the last day that I saw him, and that's when he passed away.
And it seems like everybody, especially nowadays with the internet, everybody is looking for something to say during a hard time, But
Yeah.
sometimes there's nothing you can say,
No.
right? Except just being there, just
Exactly.
letting them know that they're not alone, right?
Exactly, yeah.
So if there's any consolation, definitely for our viewers, don't get in people's faces when they're going through hard times, just letting people know that you're there for them. That's good. That's good enough
yeah.
sometimes.
And it's good to, like, just be a presence, even though you don't have to say anything.
Yeah.
It's just, you just have to hear and have, like, be a listener. Sometimes people just want to be heard.
Yeah.
And things that they could have done differently in their life. And maybe they couldn't say it in that moment, or it was too late already. But I feel like being a great listener and just kind of just letting them vent out, you learn from that in a way. And I feel like from that, knowing, hold your family close. And that's all you have is your family. They're
Yeah.
your support system. They're always there for you, no matter what. No matter what.
I remember you were talking about an account with the father had like an issue with.
Oh, yes.
Can you talk a little bit about that?
Yeah, I had a patient this is another patient, who had told me that one of his regrets was pretty much isolating his daughter because she married a man that he did not approve of. So he had not spoken to her for about 20 years.
20 years.
20 years.
Wow.
And he was telling me about it. He was like, if I would have known now, he's like, I never met my grandchildren. I wish I could speak to her and tell her how much I miss her and how much I love her. And
this was somebody that was about to pass at this point,
no,
right?
he actually he's good. He's
Oh,
alive.
oh,
Yeah.
is he? Oh, okay. But
No,
but
he's alive.
but he came to this
But
realization.
like for some reason people just like to tell me about their life stories, but
No, but I know what the reason is, because you're awesome.
Yeah.
Okay?
Oh, thank you.
Because you're supportive and you make people just, I would imagine you fulfilling your childhood aspiration of being that nurse that is just so comforting and being there for people, right? Just going through their medication and just making them feel like everything is gonna be like a comforting feeling, everything's okay. And that's why people open up to you.
That's probably like gratitude. But I guess I'm like a therapist in secret. But yeah, no, he told me that he regret having to completely stop talking to his daughter because of the man that she married. And in that point I said, well, why don't you just give her a call? I mean, it's easy for me to say hey, like, just call her. Maybe she wants to hear from you. Or, but I remember he said, no, I can't do that. No, it's been too much time, and She doesn't want nothing to do with me and this and that. So I was like, well, you don't know. You will never know. But I'm like, you know, he was like, it's too much time had passed. And he was like, I just wish that if I can go back in time, though I didn't agree with her marriage, I would have still been there, even though I don't have to associate myself with the man, but I would have been want to be in that part of her life.
Wow, that's
And it's
incredible.
tough in a
Yeah.
situation because like you don't know what all these patients go through. You know, you're seeing a patient that's sick. You know, you don't really know their life story. And every single time, you know, every patient, it's a whole different thing. And, you know, the fact that this man had a regret of not talking to his daughter and how much of an impact it, you know, after
left
all these
on him,
years
yeah.
it left. And he cried about it. And I said, just, you know, just let it out. It's fine. I said, I'm sure your daughter, deep down, she knows that you still think about her. You know, even him remembering and trying to put himself together. But, you know, things, you know, happen for a reason. And I said to him, if it was meant to be, then you guys will find a way to contact each other and, you know, get back and, you know, put differences aside or whatever had happened. You know, everybody has their own story. And hopefully, you know, I hope things work out for you.
That's amazing.
Yeah, it's sad.
It
like
is.
it's, you know.
It is. And you know, during the time that you saw him during in intensive care unit, right?
Yeah.
During that time that you saw him, you never know, he could have passed, right?
Yeah.
And it's just, man, to be in that situation where you're potentially absent from your child's life for potentially half of their life, right? 20 years, you know, and now in a hospital that you might pass and have this heavy burden of thinking, hey, you know, I didn't spend the time that I wanted to spend for 20 years with my child. That's just wow.
Yeah, that's a long time.
Yeah.
You know,
So talk to your kids if you know it's, you know, you can have drama, you can have, you know, what family doesn't, but man, you know,
yeah.
that's a huge regret to
Yeah.
have that
Yeah.
potentially I'm gonna pass and I haven't seen my child or talked to my child in 20 years because of drama, right?
Yeah.
I mean,
It's
something to think about.
It's like,
Yeah.
you know, sometimes you know, you don't realize the impact that it does after many years for over a decision that you didn't agree
Right,
with.
right.
You know, so a lot of the times, you know, that things happen, but you know, there's always, like you said, there's always family conflict. That's in everybody. Nobody's ever perfect.
Sure.
No family's perfect. There's always drama involved. But it was sad to hear that, you know, he pretty much isolated his daughter.
Right.
Like,
So I have to ask you, what would you say is the secret sauce to, you know, going through what you went through, you know, whether it's a coping mechanism or a you know, something that you can share with the viewers, you know, for their lives if, you know, they're going through a severe hardship, you know, do you have any suggestions for our viewers?
I would say listen to ASMR.
I see.
That was my coping.
Right.
Sorry, that was my coping mechanism.
Yeah.
I listen to a lot of ASMR.
Yeah.
I'm very weird like that. I also too, you know, doing things that you like to have fun with. You know, I used to love painting. I'm not a painter, honestly. I'm not like very artsy person, but it was just to get my mind off of things. Also too, like I would, you know, watch documentaries on Netflix or things like that. They're like, you know,
Getting your mind off of
getting
things.
my mind off of
Right.
things. Also trying to go out, you know, with my friends, my family. We did a lot during the when the pandemic was kind of starting to slow down. I would go with my sister and my mom. We would take a drive out, like upstate, go on hiking, you know, watch the waterfalls, things like that to kind of get our minds off from,
Right. When you're away,
everything that was
when you're away from the
happening.
war zone,
Exactly.
right? That's what you did.
And I would say,
Right.
do the things that enjoy in life, go hiking, camping, get out at times. Sometimes you just need a little bit of a break, a mental break, I would say.
Absolutely.
But, don't be afraid, be courageous, give it all you got. And, it will make you a stronger, trust me, it will make you a stronger person, and you will conquer everything. Like,
Yeah.
that's pretty much, if we can conquer COVID, I think we can conquer anything
Absolutely,
else. Because
absolutely.
obviously nobody knew how severe it was going to get. But look at us now. Look, we're in 2023.
Yep.
We're not wearing masks.
That's
We're
right.
able to be close to each other. It's not 6 feet apart, or it's not like that anymore. So now it's like so controlled. And I remember like I was afraid to even cough or even sneeze, because people will look at you like, oh no, she has COVID. So like now it's not as scary, but like if you see somebody without a mask and they're coughing
Yeah.
and they're sneezing, like,
Yeah.
first thing comes in mind, it's like, oh, they have COVID, so it's like,
Yeah.
but now it's like that fear, I think everybody
We're,
has
we're
calmed
almost,
down.
yeah, I think we're almost probably at pre-pandemic
Yeah,
time. Like
I would
as
say
far as
that,
everybody
yeah.
seems to be, pretty, routine as usual. Now, back to normal, I guess. But definitely during the heat of it, it seemed to me that, being true to your mission and making sure that you have that social support during that time
Yeah.
in the hospital, right? That really helped you, push through.
Oh,
Would you
yeah.
agree?
Yeah,
That's
I would
like the
1,000% agree.
Yeah.
If it wasn't, honestly, I can't say anything bad about the hospital and the
Yeah.
staffing. Everybody has been wonderful. Huge support system, I would say, from everybody, whether it came from doctors, nurse practitioners, PAs, ancillary team, and as well as nurses. We all came together, and try to help each other out, because we were all, we were all afraid. I'm not gonna lie, we were all afraid. In the beginning, we didn't know what to expect, and people coming up with good
Yeah.
ideas,
Yeah.
and like, we should do this and we should do that. But honestly, I can't say anything bad, because everybody was so loving and supporting, and we all, we were all going through it.
Would you say that you all had that passion to help people?
Yeah.
That's what, again, it's a burning building of COVID patients,
Yeah.
essentially, right? Like, would you say that was what motivated you guys together to go into that heart of that
Yeah.
fire?
I believe that everything we
mission,
had
passion,
that,
yeah.
We
Right.
knew what we were getting
Yeah,
ourselves
yeah,
into,
right.
and it's the risks that come with it. Not just only from developing COVID, but you can get anything else.
Exactly,
There's
exactly.
different types of diseases and bacterias and things
Right.
like that. So the risks that you're taking, but we knew that that was our mission.
Right.
We knew that we wanted to make sure that these patients made it out alive,
Yeah.
that they will be going home to see their family members. We wanted to make sure that they were stable, and that was
Most important.
most
to
important.
you and your comrades.
Exactly.
Wow.
And it was a tough time, but we had some fun times as well. We tried
Yeah,
to make it, bring
right.
in humor.
Sure.
People had that had stayed there for long periods of time. They had to celebrate their birthdays in an enclosed room, and then we would go and do a little birthday song, and I do write a little piece of paper, even with like the markers that would use, and write happy birthday, or give them like a little like cupcake, so that they don't feel so alone, because most of the time we were pretty much shutting the door, and then they're staying in there for days. They're not able to walk out of the unit. The only way that they could walk was inside their rooms, because we didn't want it to transfer to the staff. That was our biggest fear, that if we got sick, then who's going to take care of the patients? So we, at the same time, we had fun. We enjoyed it. we improvised when we didn't have things. I remember I was wearing a mechanic suit, like onesie, like that, because I didn't want to wear just a gown. I put on an entire thing. I had a cap on. I had goggles. I had a shower cap.
Wow.
And and
On top of the
mask.
on top of everything.
Yeah, so like on everything. And I remember my mom made she made like some weird spray with, she put like bleach. I don't know. I don't think it was even safe to breathe it in, to be honest. But she put like bleach, alcohol. She put fabuloso in there to make it smell better, and something else, thinking that that was going to kill whatever COVID was in the air. So she will tell me, like, before you walk in, just spray all over yourself. You come out of that room, spray all over yourself. And I don't know why I even, did it, but, I was just, I guess, because I didn't want them to, catch it. So I would just spray myself, and then people would look at me like, just, what is that? And I'm like, don't ask. I said, my mom made it, but I don't even know what's in it. I think all you see is like a purple solution there of the fabuloso that she loves to use. Yeah. And, it was fun times at the same time. Yeah. But
you know what? It's like that old saying, the hottest fire makes the strongest steel. So even though I think you got into the profession during this crazy time, I think it helps define you as, who you are as a nurse, because as you mentioned, if you can get through the pandemic as a nurse, come on, you know what I mean?
Yeah, like you can do anything.
You can do anything.
You can do
But Jessica, I don't know how else to better end this. Thank you so much. It's an honor for you to come on and help document this crazy time in human history. You are my definition of a hero. Every day, I'm dead serious. Like, a definition of a hero for me is doing the things that you don't want to do, even though it's like could be potentially dangerous to your health. So, God bless you and thank you so much for all that you do. What are you up to now, by the way? Are you studying for anything or?
Well, I'm applying actually to become a nurse practitioner.
Nice.
Yeah. So I'm kind of in between whether to become a family nurse practitioner or become an acute care geriatric nurse practitioner. I'm still kind of, I don't know if I want to do for a family, from like the babies to older age, or just stick with my older generation, which I think I kind of gearing towards the older generation. I love my old people. They're so cute. Yeah. I just love having, conversations with them, and I think I will be much happier if I do go through that.
Jessica, whatever you choose, I know you're going to be amazing.
Well, thank you.
But all right, Jessica, thank you so much for coming on. Really appreciate you. Thank you so much.
For having me.
This episode is brought to you by Jing's Mortgage Team. Jing's Mortgage Team is a team of real estate mortgage professionals whose mission is to help anyone with their real estate needs. If you're looking to buy a home, sell a home, refinance your home, have credit issues, or in need of an investment loan, we can definitely help you. If you're looking for a real estate agent, we know the best of the best real estate agents. Visit the link below for more information.